Hello, today we're diving into a topic that sparks curiosity, sometimes causes confusion, and even carries a quiet sense of shame. Does masturbation affect prostate health? There's plenty of misinformation out there. Some believe it leads to infertility, drains energy, or weakens the body, while others claim it promotes health and balances hormones. Most importantly, this topic is closely tied to prostate health. The prostate is a walnut-sized gland located just below the bladder, playing a key role in semen production, sexual function, and fertility. As men age, it can become inflamed, enlarged, or even cancerous, making it a critical area of focus. Let's first examine the scientific studies supporting frequent masturbation, including daily masturbation, as beneficial for the prostate. A 2016 Harvard University study published in European Urology tracked over 31,000 men for 18 years and found that men who ejaculated at least 21 times per month had a significantly lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. This is significant because regular ejaculation may act like a natural cleanser, flushing out harmful substances from the prostate, such as inflammatory secretions, dead cells, and potential carcinogens, thereby maintaining healthy gland function. A 2017 study in the Journal of Sexual Medicine also suggested that men in their 20s and 30s who ejaculate frequently may have a reduced long-term risk of prostate cancer. Another perspective is that ejaculation helps clear the prostate ducts, reducing the formation of crystals and the accumulation of carcinogens in prostate fluid, much like regularly flushing a pipe to prevent blockages. A study in the Journal of the American Medical Association involving 22 men aged 34 to 70 found that ejaculation increases prostate-specific antigen, PSA, levels in prostate fluid, which may help expel harmful substances from the prostate ducts, suggesting that ejaculation could be beneficial for prostate health. From this perspective, daily masturbation may, to some extent, help prevent prostate cancer. However, some studies present differing views. For instance, a UK study suggested that frequent masturbation in men aged 20 to 30 might increase the risk of prostate cancer, while frequent masturbation in men aged 50 to 60 was associated with a reduced risk. However, due to its inconsistent conclusions, the credibility of this study has been questioned. A U.S. study from 1992 to 2000 found that men with higher ejaculation frequency had a slightly lower risk of prostate cancer, but men with the lowest ejaculation frequency, less than 3 times per month, also had a slightly reduced risk, and those with the highest frequency were diagnosed with mid-stage prostate cancer at a higher rate. This suggests other factors may contribute to the risk, leading researchers to cautiously conclude that ejaculation frequency may not have a significant correlation with prostate cancer risk. Currently, the medical community has not reached a consensus on whether frequent ejaculation reduces the risk of prostate cancer, with mainstream science leaning toward it being either beneficial or neutral. Beyond its potential role in preventing prostate cancer, masturbation has other effects on the prostate. During orgasm, the body releases hormones like endorphins and oxytocin, which reduce stress, alleviate anxiety, and improve mood, indirectly supporting prostate and heart health by lowering inflammation levels. Masturbation is a relatively safe sexual activity that does not lead to unintended pregnancy or sexually transmitted infections, and it doesn't require bothering anyone else. However, there are aspects of masturbation that warrant caution. Excessive masturbation may lead to psychological burdens, such as guilt or anxiety, and could potentially affect sexual function. If masturbation becomes overly frequent and disrupts daily life, work, or relationships, it's a signal to take it seriously and moderate the behavior. If you have concerns about prostate health, it's advisable to consult a professional doctor or healthcare provider for personalized advice and treatment plans. Additionally, maintaining healthy lifestyle habits, such as a balanced diet, regular exercise, adequate sleep, and routine medical checkups, is crucial for prostate health. Let's summarize the key points about masturbation and prostate health. First, masturbation is a normal sexual behavior that occurs in nearly every man's life. While there is some debate about its relationship with prostate health, most studies suggest that moderate masturbation does not harm the prostate and may even offer protective benefits. It can help flush out prostate fluid, reducing the accumulation of harmful substances and potentially lowering the risk of prostate cancer. Additionally, masturbation can relieve stress, improve mood, and positively impact mental health. Second, we need to dispel common misconceptions. Masturbation does not cause infertility or weaken the body. These ideas stem from outdated cultural taboos and lack scientific evidence. In fact, masturbation is a safe sexual practice that does not negatively impact physical health. However, masturbation is not a cure-all. While it may help reduce the risk of prostate cancer, excessive masturbation that disrupts daily life or relationships can negatively affect mental health. Thus, moderation and balance are key. To maintain prostate health, other lifestyle habits are equally important. A balanced diet, regular exercise, routine medical screenings, stress management, and good communication with partners are all critical. These habits support overall health, which in turn supports prostate health. In conclusion, the relationship between masturbation and prostate health is complex and nuanced. While current research has not reached definitive conclusions, most evidence suggests that moderate masturbation may be beneficial for prostate health. However, excessive masturbation should be avoided, and maintaining healthy lifestyle habits is essential for overall well-being. We hope this article helps you better understand the relationship between masturbation and prostate health and encourages proactive steps to protect your health. If you have questions or thoughts, feel free to leave a comment to continue this important discussion. Common misconceptions about masturbation and prostate health. Misconception 1. Masturbation causes infertility. Many men worry that masturbation affects fertility. However, this concern lacks scientific basis. The male body continuously produces sperm, and masturbation does not reduce sperm quality or quantity. Infertility is typically caused by factors like hormonal imbalances, diseases, or reproductive system damage, not masturbation. Misconception 2. Masturbation weakens the body. This belief stems from outdated cultural or religious views that masturbation depletes a man's vitality. Modern science finds no evidence that masturbation causes physical harm. On the contrary, moderate masturbation can relieve stress and promote relaxation, positively affecting overall health. Misconception 3. Masturbation severely harms the prostate. While the relationship between masturbation and prostate health is not fully clear, studies have not found significant harm. In fact, moderate masturbation may help clear harmful substances from prostate fluid, potentially reducing prostate cancer risk. However, it's not a universal solution, and prostate health requires a comprehensive approach. Misconception 4. Masturbation causes sexual dysfunction. Some believe masturbation leads to issues like erectile dysfunction or premature ejaculation. However, sexual dysfunction is typically caused by multiple factors, such as stress, hormonal levels, or vascular health. Masturbation itself does not directly cause these issues, though excessive masturbation may lead to dependency, potentially affecting sexual experiences with a partner. Moderation is key. Misconception 5. Masturbation spreads STDs. As a solo activity, masturbation does not involve a partner and thus cannot transmit sexually transmitted diseases like HIV, gonorrhea, or chlamydia. This makes it a relatively safe sexual practice. However, proper precautions are still necessary during sexual activity with others to reduce STD risks. Misconception 6. Masturbation alone ensures prostate health. This view is overly simplistic. Prostate health results from multiple factors. While masturbation may help, it cannot replace other critical habits like a balanced diet, regular exercise, routine screenings, and stress management. Misconception 7. Only men with unsatisfying sex lives masturbate. This ignores the fact that masturbation is a common and normal behavior, regardless of one's sexual relationship status. It can be a healthy way to explore sexual needs and relieve stress, especially for single men or those with less frequent sexual activity. Masturbation should not be stigmatized. Misconception 8. The more frequent the masturbation, the better. While moderate masturbation may benefit prostate health, excessive masturbation can lead to physical discomfort, such as skin irritation or pain, and may negatively impact mental health, causing guilt or anxiety. Finding a suitable frequency based on individual needs is essential. Misconception 9. Masturbation has the same health effects at all ages. As men age, their bodies and sexual functions change, and the impact of masturbation on prostate health may vary. For example, in adolescence, masturbation is a common exploratory behavior with no adverse effects. However, as men age and the prostate enlarges, increasing the risk of prostate issues, older men should monitor their body's responses and consult a doctor if concerns arise. Misconception 10. Masturbation can fully replace sexual intercourse with a partner. While masturbation is a healthy and safe sexual activity, it cannot fully substitute the emotional connection, intimacy, and interaction provided by sexual intercourse with a partner. Sexual activity with a partner offers psychological and emotional fulfillment that enhances relationships. Masturbation should be seen as a complement, not a replacement. Misconception 11. Masturbation causes irreversible bodily harm. Some believe masturbation causes long-term physical damage. However, no scientific evidence supports this. Masturbation is a natural physiological process, and when done in moderation, it does not harm the reproductive system or other organs. If discomfort or pain occurs, stop and consult a doctor. Misconception 12. Masturbation reduces semen quality. Semen quality is influenced by factors like hormones, lifestyle, and environment. While frequent masturbation may temporarily reduce sperm count in semen, it does not affect semen quality long term. The body continuously produces new sperm, typically completing a cycle every 2 to 3 months. Misconception 13. Masturbation affects height or physical development. This is entirely unfounded. Height and physical development are determined by genetics, nutrition, and growth hormones, not masturbation. Adolescent males experience rapid physical changes, but these are unrelated to masturbation. Misconception 14. Masturbation causes erectile dysfunction or premature ejaculation. In rare cases, excessive masturbation may lead to temporary issues, such as delayed ejaculation or reduced response to non-sexual stimuli, but these are not equivalent to erectile dysfunction or premature ejaculation. These conditions are often psychological or multifactorial, not directly caused by masturbation. If such issues arise, consult a healthcare professional. Misconception 15. Masturbation increases testicular cancer risk. No scientific evidence links masturbation to testicular cancer. Testicular cancer is typically associated with genetic factors, undescended testicles, or family history. Masturbation does not increase this risk. Clarifying these misconceptions is crucial for men to understand their sexual health and adopt healthy lifestyles. While moderate masturbation may offer benefits, its impact on prostate health is complex and varies individually, influenced by multiple factors. Benefits of moderate masturbation. It can relieve sexual tension, boost mood, improve sleep, enhance confidence, promote blood circulation in reproductive organs, improve sexual performance, release endorphins, reduce stress, boost immunity, and potentially lower prostate cancer risk. Risks of excessive masturbation. These include prostatitis, urinary tract infections, sexual dysfunction, reduced immunity, lack of focus, disrupted work or studies, psychological burdens, mood instability, inflammation, and, in adolescents, potential nutrient depletion affecting growth or future fertility. Excessive foreskin pulling may cause paraphimosis, requiring surgical intervention, while frequent masturbation may damage genital skin, increase infection risk, or lead to sexual dysfunction like premature ejaculation. Masturbation's impact on health. Physiological. Moderate masturbation may clear prostate fluid, reducing harmful substances and prostate cancer risk. However, excessive masturbation can cause repeated prostate congestion, leading to inflammation, genital skin damage, or infections, potentially affecting sexual function. Psychological. Moderate masturbation relieves stress and sexual desire, benefiting mental health. However, feelings of guilt or negative emotions can lead to anxiety or depression, affecting quality of life. The impact varies by individual, with moderation and a healthy mindset being key. Moderate masturbation frequency. This varies by age, physical condition, and psychological needs. Younger men with faster metabolisms and higher sex drives may find 2 to 3 times per week suitable. Middle-aged men under stress may find 1 to 2 times per week reasonable. Older men with declining physical function may find 1 to 2 times per month appropriate. Adjust based on individual needs, ensuring it doesn't disrupt life, work, or health. Managing masturbation frequency. 1. Cultivate healthy hobbies to shift focus and enrich life. 2. Maintain a regular routine to avoid boredom-induced masturbation. 3. Engage in moderate exercise to reduce sexual impulses. 4. Learn about reproductive health to curb curiosity. 5. Use self-affirmation and psychological regulation to resist temptation. 6. Create a comfortable living environment to maintain a positive mindset. 7. Limit exposure to sexual stimuli to balance sexual health. Masturbation versus sexual intercourse. Sexual intercourse is a mutual act that meets physical and psychological needs, fosters emotional bonding, and supports family stability. Masturbation, a solo act, cannot replace the emotional or reproductive aspects of intercourse. Moderate masturbation can relieve sexual tension, but excessive masturbation may disrupt sexual relationships and health. For sexual dysfunction, assess sexual history to identify causes and tailor treatment. Sensations during masturbation. These vary, including pleasure, guilt, fatigue, relaxation, anxiety, or discomfort, influenced by psychological state and environment. Pleasure comes from neural responses to genital stimulation, releasing dopamine, differing from intercourse. Moderate masturbation relieves stress, but excessive masturbation or psychological stress may reduce pleasure or cause discomfort. Adolescent sexual health. Puberty is a critical period for sexual awareness and physiological development. Proper guidance is essential. Promote sex education, foster healthy family environments, encourage positive parental attitudes, cultivate hobbies, promote exercise, and encourage positive friendships to help teens navigate puberty healthily. Prostate cancer and masturbation. The link remains inconclusive. Moderate masturbation may be beneficial, but excessive masturbation could increase risks. Prostate health is influenced by age, genetics, lifestyle, and environment. Preventive measures include a balanced diet, regular exercise, and routine checkups, though they cannot fully eliminate risk. Prostate cancer prevention strategies. Monitor prostate health and seek medical attention for abnormalities. Undergo regular screenings for early detection. Eat a balanced diet rich in vegetables, fruits, whole grains, and healthy fats, while limiting red and processed meats. Exercise regularly and maintain a healthy weight. Avoid excessive calcium intake. Refrain from unnecessary vitamin or mineral supplements. Quit smoking and limit alcohol. Maintain a healthy sex life. Avoid prolonged sitting. Prostate health tips. Foods like tomatoes, pumpkin seeds, salmon, green tea, and Brazil nuts support prostate health. Maintain healthy habits like regular exercise, adequate sleep, consistent routines, avoiding holding urine, minimizing prolonged sitting, and practicing good hygiene to reduce prostate disease risk. In summary, the relationship between masturbation and prostate health is complex, influenced by individual differences and multiple factors. Moderate masturbation may offer benefits but is not definitive, and excessive masturbation carries risks. Men should adopt healthy attitudes toward sex, maintain moderate masturbation frequency, monitor prostate health, and seek medical advice when needed. Comprehensive measures, including healthy lifestyles and regular checkups, are essential for prostate health, with masturbation being just one part. If you have concerns about prostate health, consult a doctor or healthcare provider for personalized advice. Maintaining a balanced diet, regular exercise, adequate sleep, and routine checkups is critical for prostate health. We hope this article clarifies the relationship between masturbation and prostate health and encourages proactive health measures. Feel free to share your thoughts or questions in the comments to continue this important discussion.